Are you curious about Gestalt language processing? You are not alone. Join me, Corinne Smoose, and Speech Therapy PD for our podcast, The Gestalt Get Together. Our episodes try to balance the enthusiasm and excitement about GLP and its associated intervention ideas, as well as a healthy dose of skepticism about how to understand and integrate this paradigm shift into your career and the field at large. We hope that you can get together with us to learn more about Gestalts.
Welcome to the Speech Link. I'm your host, Shar Beauchart, and I invite you to listen and learn practical strategies from experienced experts to take your therapy to the next level. Getting a child to say a good sound is one thing, but getting them to use it consistently is another. Now, you know the EasyR program for getting the but what about generalization? Well, what about the new R speech practice audios? Kids love to practice them, and you quickly access them via QR codes. Go to speechdynamics.com to take advantage of the 40% off sale price. Do it now. All right. Ooh. Well, I think we are starting. And hello, everybody. And before we actually start, let's talk disclosures. Regarding financial disclosures, Dr. Reed receives an honorarium for this podcast from speechtherapypd.com, and she receives a salary from Alabama A&M University. Personally, I too receive an honorarium for the Speech Link, and I am a presenter for speechtherapypd.com. And I receive royalty payments. I also own Speech Dynamics, Inc. Regarding non-financial disclosures, neither Dr. Reed nor I have any to report. Okay, all right. So welcome to our Speech Link podcast, sponsored, of course, by speechtherapypd.com. I'm Shar Beauchart, your speech language pathologist host, and I'm so glad that you're here for our very timely topic, orofacial myofunctional disorders instruction at the university level. Whoa. I cannot wait to hear what Dr. Reed has to say about this. It's very exciting. But to all of you, you're very welcome to participate during our time together. Just, type your question or comment into the chat, and one of us will read it, and Dr. Reed will respond. So Dr. Hope Reed, SLP.D, CCC-SLP, COM, Certified Orofacial Myologist, earned her doctorate in speech language pathology from Nova Southeastern University. She's a fellow of the American Speech Language Hearing Association and is a professor of communicative sciences and disorders at Alabama A&M University. She joined the faculty there in 2002 and teaches graduate and undergraduate courses in craniofacial anomalies. Now get this, craniofacial anomalies, articulation, phonology, language, fluency, and methods and materials for school-based SLPs. I'm thinking she's like a one-man band there. She covers it all. And importantly, she is a certified orofacial myologist. And Dr. Reed has established the world's first university-based clinic for children and adults with orofacial myofunctional disorders. Her research encompasses such topics as health literacy, counseling students and patients, e-learning fatigue. Ooh, I'm kind of excited. We got to have you back for that one, as well as orofacial myofunctional disorders. And she's a frequent presenter from international to local conferences, and her clinical experience encompasses public schools, private sector, healthcare, Head Start, and university settings. So she's done a lot of therapy, which is a really good thing. And she's worked in the field of speech pathology for 25 years. Dr. Reed is on the editorial review board for the International Journal of Orofacial Myology and Myofunctional Therapy, which is the official journal of the IAOM, the International Association of Orofacial Myology. And notably, she established and is chair of the Institutional Review Board, the IRB, for the IAOM. Very cool. And she's been recognized in our field for Distinguished Service Awards, Outstanding Clinical Achievement Awards, as well as receiving numerous certificates of appreciation and commendation for her service to the profession. I have no doubt that all of those are well deserved. And she prefers for us to call her Hope instead of Dr. Reed. So a hearty welcome to the Speech Link, Hope.
Thank you so much, Shar. I have just been so excited. I could barely sleep this week looking forward to this presentation and talking with you. And I'm just grateful and thankful, appreciative that you invited me to join your podcast.
Well, I'm thrilled that you accepted. And I too I really accepted. I mean, we've got an hour here and we can cover, some information, but I just have a feeling that you've got a lot of unique things to say, because I've never talked to anybody who has actually, incorporated this into their university setting. So this is something new. I'm really excited to hear about that. So to begin, I have never met anyone who says that during their university years, they received orofacial myofunctional disorders information, or they had an opportunity to do myofunctional therapy in the clinic. Not a one. And I certainly didn't. And, I want to rush in and ask you how you did this. Okay, but I'm going to hold off on that. So I'd like to begin with the question of what motivated you to begin introducing myofunctional therapy into your university clinic.
Okay. Well, I did learn about myofunctional disorders and this is probably, a lot of the impetus behind what I do now. My best friend, who was my instructor, clinic director in undergrad and grad school, Dr. Jennifer Vinson, she had attended a seminar with the late Roberta B. Pierce here in the Huntsville area. She was here, practiced for 40 years, life member of AAOM, past president, literally wrote the book for therapy and treatment in this area. And so Dr. Vinson was teaching my clinical procedures class, and she did, maybe a one-day session with us, kind of introducing us to orofacial myofunctional disorders. And I later went on, all the pieces of the puzzle just fell into place for me. I later went on to work in private practice with Roberta Pierce. And so I worked in the public schools, was working in the public schools. I would see Roberta's patients in the summer when, like you, Shar, she would go on these wonderful speaking engagements to Hawaii and wonderful places. And so I would stay back in Huntsville and see patients for her. And then when I enrolled in my doctoral program, the university, Alabama A&M University, caught wind that I was in a doctoral program. And of course, we need instructors and doctoral level people in our field, and we did then, certainly. And they asked me to come back and teach. Wasn't teaching the same courses, of course, 20 years ago that I teach now. I wasn't doing the RTIC and phonology coursework, but I was teaching methods and materials for school-based speech language pathologists. Mm-hmm. And Dr. Vinson, who was still there at the program, she is now since retired, but she's my dearest friend in the world. She said, would you consider, could you include, and do you have time to cover the myofunctional related content in this course? Because of course, if you're teaching students to prepare them to be school-based speech language pathologists, which ASHA loves that we have that course in our program, would you have time to introduce some orofacial myofunctional content? And so that's where I started. And it really seemed to be a nice fit. It worked very well. These were undergraduates at the senior level. So they had the background in RTIC, and other courses, they could handle it at that level. And then, of course, now I teach our undergraduate articulation phonology course. And so I can incorporate it there.
Wow. Okay. So you had a stepping stone. Mm-hmm. You had someone or a couple of someones mm-hmm. that were already experienced, understood the need, mm-hmm. and I'm going to say the depth and the breadth of the field, mm-hmm. and which is wonderful. So you kind of piggybacked, and you were a perfect young person coming into the university. You had done therapy, and so you just absorbed all of that information, and they said, now just release it in the school, in the in your content for your courses, and then also in the clinic. So you had interested people at your back and at your foundation, which is wonderful. Now, you said something there that ASHA, please clarify this for me, that ASHA is or was accepting or very happy to hear that you have an orofacial myofunctional content
They were
course, or what was that?
our methods and materials course. We don't at Alabama A&M just teach the ASHA, the big 9, as we call it, RTIC, language development, audiology, those classes. We teach other classes. And one of those courses that's been in our program since I was a student there is methods and materials for speech language pathologists working in the public schools. Long course name. We just call it methods and materials.
Right.
And ASHA, I've been through several site visits, accreditations, reaccreditations over the years as a student and faculty member now. Yeah. And they've always been pleased and had favorable comments that we have that course in our curriculum, because statistics say that over half of all SLPs at some point will work in the public schools. And I've always said that's where we bring our services to the masses. That's how we reach the majority of America's children, and how we get our services out there. So, my heart is for those school kiddos and those school SLPs. And so they've always responded favorably when they see that we've left that. And of course, it's evolved over the years, but we've kept that course in our curriculum for our undergraduates.
Yeah. Oh, good. Wow. All right. So, I'm so glad to hear that. I know exactly what you're talking about. When I taught at Loma Linda University, we had a course called Procedures and Materials. So it was kind of the same thing. Yeah. Which is kind of the application piece, of here's the theoretical stuff, and now here's the application. And I think everybody needs that, maybe a course or two at least. But yeah, I love that. Okay. So let's lay another foundation here. In your expertise and your knowledge, how do you describe what are orofacial myofunctional disorders?
Facial myofunctional disorders, I kind of pull from a lot of different resources when I do my definition there. These are patterns of behavior that involve, the oral and the facial structures and muscles. And if they're doing something outside of what we consider the norm or typical behavior, then we tend to think of that as, being in line with a myofunctional disorder. Is it interfering with normal function? Is it interfering with growth, with the dentition? And is it creating, occlusal issues? And just that good old Van Riper definition, does it call attention to itself? Yeah. And so, that's kind of my nutshell of myofunctional disorders.
Okay. And are you thinking as far as functions, oral functions, speaking, chewing, swallowing, or do you divide? Do you have some boundaries there, or you just open it up to oral functions?
I open it up to, because to me, the myofunctional disorders impact speaking. A lot of times we see a lot of kids with RTIC disorders who also have the myofunctional issues underlying the RTIC problems, the chewing and the swallowing. And then also it includes those behaviors, habits, negative habits, that can also play into, some of the issues we see. So fingernail biting. I worked with a fingernail peeler years ago. Very interesting case, very painful to look at. Fixed it. Chewing, biting on pencils, children, chewing and biting on their shirts. So, and then the thumb sucking, digit sucking habits, tongue thrust. Of course, that's the thrust of what I do in my clinic, tongue thrust. So really, I consider all of that. I don't really get into the pediatric and infant feeding, swallowing, breastfeeding. I don't start seeing my kiddos in the clinic until they're 4 for the digit thumb sucking habits. And then at age 8, and I'm pretty strict with that. Actually, I'm very strict with that. Age 8 for the tongue thrust issues.
Mm-hmm. Okay. All right. So these kinds of things, and I know that these are just, sort of hitting the surface. Do you include this kind of thing in your course content? Are you like, what course would it be in? Is it on your articulation, craniofacial? What course do you include this in?
Mostly it's included in our undergraduate articulation disorders course. And I can
Okay.
go into kind of an outline of things I teach in there. I haven't, since I've been teaching the Artic class, I haven't had to pull it into the methods course since, but I was teaching methods before I was teaching Artic. So that was where, we decided to put it.
Okay.
At the graduate level, it's a summer course, and so it's really, that's intense. You've got all of the ASHA student learning outcomes to cover in an 8-week session that you would normally cover in 16 weeks. So I do address tongue thrust, but it's more of a cursory, a very introductory kind of view to tongue thrust. But a lot of our students I have taught at the undergraduate level. So by the time they get to the graduate level, it's kind of a refresher for them what tongue thrust is. And it's covered in the craniofacial textbooks I'm using. Ann Coomer does a good job of addressing that. She's got some good handouts for students that I've used. But mostly it's in our undergraduate articulation and phonological disorders course.
Okay. Let me just ask you here, and I don't know if we talked about this question. In fact, I'm pretty sure we didn't. What would you say? Why would you say that most university departments do not include orofacial myofunctional disorders in their curriculum? What would be your thought? Now this is you speculating.
Sure. Yes, it's speculative. But we do have some surveys. We do have some data. We know it's not being included. I think one factor is there's so much, ASHA accredits graduate master's level speech path programs. And of course they do the audiology side, but speech path, we have those big 9 courses. We have to cover all that content. We have to cover all of those student learning outcomes. And that's a lot of information. I went through school when we didn't even have a dysphagia course. I took dysphagia at the doctoral level. So we keep just having to incorporate more and more because our scope grows and grows, and our stakeholders, they have things that they demand from university programs. We have to be mindful of that when we go up for our reaccreditation cycles.
Mm-hmm.
So I'm not sure that there's, I think it can be challenging to find time and, where will we put the content? That's a little less challenging because there's certainly courses where it fits better. But then also I think we just, we have, I don't think we have enough certified orofacial myologists. So in the university settings, I know, seems like Ole Miss, University of Mississippi, has had a person there, and the name is escaping me for a while. We've had, I think, Joni Lofton up at Idaho State. And of course, I got an email from Akron, University of Akron, the other day with one of your colleagues. So it's just few and far between. It seems like those of us who are certified orofacial myologists who work at the university setting, we naturally bring it in, but you just don't have enough COMs within universities. And so we're going to be the ones who push for that content to get included.
Mm-hmm.
So,
Yes.
and it's
Okay.
it's a specialty, it's
Yeah.
a secondary specialty area. Of course, we all have to be certified in our field as speech pathologists, or you do have registered dental hygienists who are COMs, but it's a specialty certification on top of everything else we have to do. And I think those present challenges for university settings.
Yes.
But it is in
Yes.
textbooks more and more, I'm proud to say.
Is it really?
Yes. And I was so pleased. It was in Pena Brooks' ProEd, her articulation disorders textbook.
Yeah.
And it is one of the 9 factors that influence speech development, speech disorders.
Well, hot diggity. Is that the one? I think I have her older book. It's the white book, the big, thick white book.
It's kind of a turquoise and purple edition now, but it's very thick. It's been around. I've probably got, several editions of it.
I like that.
Yes, there's a white one and like a white and blue background.
Okay. Yeah.
Yes.
I like that book a lot.
Yes.
Well, good.
Yes,
well,
it's in there.
That's
and
amazing.
A very good description of it. Yes, I'm so excited.
Oh, yeah, that is exciting. That is really exciting. When I was asked to teach, I taught at Loma Linda University for a while, and then I did an adjunct undergrad articulation course at Redlands University, and I taught Artic over at Loma Linda as well. And I wanted to include some information about the mouth. Okay, silly me. I wanted something orally based, oral oriented information. And honestly, I could not find a textbook that even covered more than 2 or 3 paragraphs, just cursory information about the mouth. I mean, I was really disappointed. So I'm very heartened to hear that at least we have one. And I'm sure that it'll grow. And, when you start writing your textbook, Hope, you'll have to include it, so you never know.
I have a counseling textbook. Of course, it's been out of print for years now, but yeah. The Artic side, that was 2011. So that's, the life of a textbook is just a few years.
Yeah, but counseling doesn't go out of style.
No. Counseling is more in style than anything. So that's my other love. Yes, that's my other love.
Well, where could we get our hands? Is it still around at all?
Well, it was published by Lingua Systems, and their founders retired, and they sold off some of their product line to Super Duper and ProEd. But it might be floating around out there on Amazon still. But people can join me at a seminar or a talk sometime. I'm still doing the counseling thing, and I teach our counseling course too. So not to get off track from myofunctional, but yes, I'm so excited it's in the textbooks. And the thing about textbooks, what I'm seeing, the trend in our field too, is they are becoming. I mean, we still have to cover theory. We still have to, still have to do theory. Of course, that's the underpinnings for evidence-based practice and everything.
Right.
But textbook companies, publishers, they are working more and more to make the information for students more practical and more relevant, and doing case studies. And so I think that's part of what's brought the tongue thrust and the myofunctional component in to that major textbook in our field, is because they're recognizing the relevance of it, and we can't just leave that topic out.
Yes.
It has to be addressed.
Good. Oh, I'm so glad. I'm so glad. Yes. When I was researching for, actually, I think I was researching for the Perfect Oral Motor Storm, I came across many, and actually they were posted on ASHA, several journal articles that did extensive reviews of articles, over the years. And I mean, they found such things like in the field of language therapy, where there was absolutely nothing on working with middle school kids with language disorders.
I believe it.
Yeah. And, and we had nothing that really verified how many sessions we should do, or how intensive we should get, or, anything that was that of practical nature of what we should really be doing. We have a lot of information about language, and it has just grown through the years, but nothing really that focused on the application of it. And, that kind of takes me back to the whole oral motor thing, Well, I can't tell you how many journal articles that I read, and I read a lot of journal articles. I can't tell you the number. At the very end, it always says more research is needed. More research needed. And it certainly was validated in that, the 2006, 7, 8, 9, 10 years when all of those review articles were done. And it blows my mind. So I'm thinking that maybe now, here we are, a good 10, 15 years down the line, that now researchers are kind of getting the message and figuring out how to research the practicality of what they've been teaching and what we've been learning. And so maybe it's starting to come to fruition.
Exactly. And I know Dr. Nancy Solomon, who you and I have both presented with. She is the editor-in-chief of our International Journal of Orofacial Myology, the official journal of IAOM. She's really out there pushing for more research. And so clinicians, we need clinicians who are willing to do research and write up case studies. And she's a great help with that, because I think sometimes I have so many SLPs out there who say research scares them. It doesn't need to scare you. What you're doing out in the field every day is daunting. You're out there, confronting problems and dealing with, everything that's being thrown at you and learning about it and keeping pace, with the profession. And so I would encourage people who are working with children with myofunctional disorders, or who even have an interest in it, and you see it in your caseload, write up a case study, partner with a university person if the research piece is daunting. And those partnerships work very well. We've gotten some really good research out of those partnerships with especially school-based people and university people.
There you go.
Works out very well. And so I would encourage people, consider submitting an article to the International Journal of Orofacial Myology. Contact me. I will, assist you with that endeavor to the extent humanly possible. So yeah, it's exciting that
wonderful.
We're moving forward and we're moving along, but yes, more research is always needed, especially in this area.
Yes, definitely. And I'm just, I want to second it. And I've worked a little bit with you, and I've worked a little bit with Nancy Solomon, and both of you are extremely knowledgeable, but I'm going to say very down to earth, and you have your feet firmly planted in the desire to move forward and to help other SLPs on how to do the research. And I understand, yes, it can be scary, but sitting across from an 8-year-old that's having difficulty with speech and maybe difficulty with swallowing, and has some behavior issues, and that's daunting.
Yes.
Trying to work with a human being. And I've always said that therapy is trying to get another person to do something that they can't do.
Yes.
That is therapy. We are not teachers. We don't stand up there and we just say, here's the information, go ahead and just absorb it and learn it. No, therapy is different. It's very different. And it is, I'm going to say, behavior shaping.
Yes. I tell my students all the time, I tell them every day, we are behaviorists. We talk about behavioral theory. We talk about the behavioral approach in counseling. We're two things I tell my students, all the time. We're behaviorists and we're child development experts. We're child developmentalists. Those two things, especially if you work with children, as that has been, most of my career.
Yeah, exactly. And we cannot know too much about both of those. I mean, we really can't. So,
And if you ever want to feel like you don't know enough, sit in front of an 8-year-old, sit in front of a table full of school children. And and you're like, oh gosh, I just can never know everything I need to know. Yeah. But
well,
that's exciting
yeah,
too. It's exciting
yeah.
that there's always something else to learn.
Oh, there is. And I'm, the thing is, people purport theories and methodologies and so on, and I certainly have done that through the years. But the thing is, as soon as you learn how to do that and you apply that with a child or 2 or 10 or 100, here comes one that just is outside the mold.
Mm-hmm.
And you're kind of back to square one and having to figure it out. And the nice thing about orofacial myology is that it gives you other options to look at, and other things that may be a factor in impacting speaking, chewing, swallowing, or whatever that function or functions that you're working on. And I think, now I don't know this, but let me just throw this out and see what you think about this topic. Or this, I don't even know if it's a topic, but it's something that's in the back of my mind, and I'm just wondering if you think it's true or not. We have focused for the last, oh, geez, I'm going to say 30, 40 years, pretty much as in regarding to speech, pretty much on the auditory piece. And we've had a heavy focus on the auditory piece and how it relates to the cognitive piece and language development and so on, as far as the phonological development of a child. And I certainly, I certainly understand a lot of that. I'm not an expert in it, but what I know makes sense. But also, there's a lot of individuals that if we do, say, some type of word pairing therapy with them, or some other type of therapy that's more auditorily based, sometimes that works and sometimes it doesn't. And a lot of times I think we need to delve deeper, and we need to look at that source of speech, which is the oral mechanism. And oral, respiratory, et cetera, mechanism, phonatory, you throw them all in there. There's something amiss. And I'm not saying to throw out the auditory piece. Obviously, that's critically important, but to bring in that oral-oriented piece that contains several options for us to look at. And if we find something, that's awry, then we try and remediate that, or at least work around it, or do compensatory therapy, or, as you say, work with the muscles and so on. So I think it gives us additional therapeutic options. I don't know. What say you?
Absolutely. In teaching the undergraduate, and I think we had a question about the textbook. It's Pena Brooks, PEN with the tilde over it, hyphenated Brooks, Brooks. It's from ProEd. It is, I want to say the title, Assessment and Treatment of Speech Sound Disorders, but it is kind of an aqua and a purple color, but it's Pena Brooks. If you just key in on that author, that's one of the 2 authors, I think.
Yeah, she's good.
But in teaching articulation disorders, I am still amazed how much time is spent in the textbooks talking about the auditory piece, which absolutely it is a piece of the puzzle. But then there's also some research that says, we've focused on auditory discrimination between the error and the target sound for so many years. And there's research trending towards, a lot of kids who have speech sound disorders, they understand the difference. They can discriminate between the target sound and their error sound, and if they can't, of course, we need to address that. But it is amazing how little time is actually spent on the mouth components of it all. Because we're speech language pathologists, sometimes I think maybe the auditory component might be the easier. I don't want to say research is easy. None of it's easy, but the easier piece to research. And so maybe that's been the thrust behind a lot of it. I think it gets a little more complicated when we start dealing with people's mouths and there's so many more differences here than there are here. It just in,
Mm-hmm.
the way I
Mm-hmm.
perceive things.
Mm-hmm. Good point.
But yeah, we don't, and we do the oral periph exams, oral mechanism exams. But we need to pay more attention to what's going on in and around here.
Are you taking advantage of our new handy feature, the certificate tracker? Keep a record of all your CEUs, not just for any of the 750 audio and video courses here at speechtherapypd.com, but from anywhere. Upload your certificates and voila, you have an organized, all-in-one-place record of all your CEUs. Cool. Yes, and how it can impact speaking, chewing, and swallowing. So talk with me a little bit about issues that you see and how they do impact speaking, chewing, swallowing. And I'm sure that you can reflect back on some cases or just how, what you teach in your courses, your course content, or, marry it together a little bit for us, if you would.
Okay. Well, I do a lot in every seminar where I present or, webinar, whatever the case may be. And in my classes, I talk a lot about the red flags associated with tongue thrust. Swallowing with those back teeth completely apart, poor movement of the masters. I call it the busy chewing, the busy face. You've got the temporalis muscles going, you've got all kinds of tension around the lips, and in the mentalis, the masseters are underactive, but they need to be more active. The speech component with that, the problems with the S, especially the frontal lisping, the interdentalizations, TD, L, and N, R, of course, if we have that incoordinated tongue. Not focusing on strength. It's hard to quantify strength, but focusing on the incoordination. We know that if we can get those muscles more coordinated, then that can help with R as well. And looking at, is a child a messy eater? I had a sixth grader in the public schools years ago, and she would have salad dressing just oozing out of her mouth, messy eating. The biting of the lips, dry lips, licking the lips a lot, with that and that chronic open mouth posture, not necessarily mouth breathing, because Dr. Bob Mason warns us, he's been warning us about that for years. Don't think that just because a child is sitting there mouth open that they're breathing through their mouth. It's an open mouth rest posture. We don't know if they're actually breathing through their mouth or not. So, we've learned to not just assume it's mouth breathing. And then, of course, a trend that we can address later if we have time, the sleep disordered breathing in children. I'm hoping I've addressed everything you wanted me to, but just the muscle incoordination, the open mouth resting posture, messy eaters, getting tummy aches after they eat frequently. Any kind of digestive problems, looking at babies who maybe had a history of colic, extended bottle feeding, and oh my goodness, this could be an entire podcast in and of itself, sippy cups. I get a lot of questions about sippy cups. So I hope that's how you wanted it married together.
I wanted you to marry it however you see it fits. Yeah. And see all of that. Boy, I looking at orofacial myofunctional muscle function disorders. And I mean, that's pretty broad. And, as I look at the individual functions, we look at speaking, and let me just add a little bit to what you were saying, which was really good. But something that I have, and you and I talked about this, something that I kind of discovered through the years that really helped me to look at oral functions and then to look at those other things that you were talking about as far as the tongue thrust, which is a tongue that is at the horizontal midline of the mouth and moving horizontally. Or, you have lack of the dentition closing and the masseters not contracting and so on. Mm-hmm. And I have learned through the years to take a lot of those things and apply them to two words. and sort of sort them and see which camp they belong in. And the two words are stabilization and mobilization.
Mhm.
So if we look at mobilization, and which, we have looked at mobilization in swallowing and speaking and chewing for many, many years. That mobilization piece has been the focus. But we look at the stabilization piece, it broadens and makes sense. And so if you have an individual where the jaw's lowered a little bit and the teeth are apart and so on, and the tongue is at the horizontal midline and it's moving forward, what we're lacking there when you bite your teeth together in order to swallow, that is a stabilization piece. Also, as you bite your teeth together, it helps to get the tongue, the tongue does have to go the rest of the way to the top.
Mhm.
And so you can ascribe a lot of those things that you were talking about to stabilization and mobilization. And as far as resting postures, I am a major resting posture proponent. Why? Because when the tongue is elevated and, the front fourth to third is sitting on the alveolar ridge and you have the sides of the tongue, touching this top side teeth, that is in the optimum operating zone
Mhm.
for especially for your swallowing, but especially for your speaking. Many of our speech sounds happen above the horizontal midline, up within the dental arch, which is this, and the sides of the tongue brace and hold on and gives anchorage to that moving part or the moving part and back. And so you have stabilization must take place near the moving part to give you, and you used this term, to give you control. So in order to
Exactly.
look at, yes, that mobilization piece is so very important. And we talk about place, manner, voice. And how the front part of the tongue moves and interacts, and you have a fricative and you have all those things. The thing is that gives you that capability for that front part of the tongue to move and for the tongue to anchor itself within that placement, that elevated placement, is the sides of the tongue gives you that anchorage to keep that tongue in place. And then you have the internal stabilization and internal contraction in the mid tongue, which enables the front part of the tongue to move and sustain itself in space as you generate the front part that's in the spatial realm. It's not touching anything as air flows through for your fricatives, for your front tongue fricatives. So I would add taking a really interesting look at that stabilization piece. What do we need to do for speaking, chewing, and swallowing from that stabilization perspective? And then how does all of those stabilization pieces fit together with the mobilization? And wow, that just opens it up. Just
Mhm.
opens it up. So yeah, just
And ASHA would agree with you because I use the practice portal all the time. I am a huge fan of the ASHA practice portal. And it sounds like, Shar, you could have written the orofacial myofunctional disorders section within the practice portal, specifically how to improve speech sound, articulatory placement. It's exactly the things that you just said. And it's that
really.
stabilization. Yes,
All right.
you
Good.
mirrored. I mean, you could have, for if I didn't know better, I would say you wrote that piece because it talks about what happens when we try to initiate speech sounds from an abnormal placement and we don't have that stabilization component that you're talking about.
Okay. Hot
So, I
diggity.
mean, yeah, now that's the perfect marriage right there. You got it between
Yeah.
the practice portal and what ASHA has found the research to be and what you have found the reality to be, marrying theory with practice. Yeah.
Yes, yes. Well, you've got, Brian Jick, and you've got Stone, and you've got Gibbons, and you've got Fletcher that focused on the palatography work, and they did so much great research on the palatography that indicates the stabilization, the sides of the tongue and the sides of the teeth and the perimeter of the palate. Then you've got Brian Jick, who has done his work. And he wrote an article in 2017 that says, speaking tongues are always braced. In fact, that is the title of one of his articles. Speaking tongues are always braced, giving that support to the moving parts. It has to have that. So when your tongue is in a lowered position and you're moving horizontally, you're not stabilized anywhere. You know,
Right.
and so that
Absolutely.
tongue thrust piece. Yeah.
Absolutely. Absolutely. And of course,
Yeah.
all that marries up with an open mouth posture. And if there is not an optimal breathing, whether it is mouth breathing or not, if the nose, the nasal passages have some kind of an obstruction, all of that, it all goes together. It's all connected in some
It
way.
does. It does. It does. And I've used the term through the years that there's so many crossroads of disciplines that is involved and can be impacted. And so we have a lot of dentists and orthodontists, and we've got
ENTs.
ENTs. Yeah, you've got
if that child
respiratory
can't
people.
breathe, if that child cannot breathe freely through the nose when they come to see me for tongue thrust therapy,
you're dead
then
meat.
that's the first thing that we've got to tackle that with an ENT is to get that child freely breathing through the nose, because I can't have that child breathing if it is a case of open mouth posture with mouth breathing. We've got to resolve that. We have to.
Sure.
Otherwise, everything else won't fall into place either. You have to have a good foundation, a good airway. Yeah.
Okay. And we have someone here that says, please write those authors' names in the chat or spell them. And
I think those were the articles you were mentioning with the palatography.
Oh, okay. Yeah. there's a ton of them. There's an absolute ton of them. You know what? Email me and I will send you the bibliography. You're welcome to email me. I'm Char, CHAR, at speechdynamics.com. And I can send you a bibliography. I won't send you 50 pages, but I'll send you, yep, there it is. I'll send you, probably 4 or 5 pages and maybe star some of them. But there's a lot of research, and that's just on the sides of the tongue, the external stabilization. Then you've got the 1986-87 articles in the physiology field, where they focused on the internal stabilization of the tongue and how the front part of the tongue can only move when you contract the mid part. And boy, do we use all of those. L, retroflex, I mean, so many of our speech sounds are generated with just refined small vertical movements. And
if
that's
you ever
86.
watch imaging of a person speaking, there are so many fine movements, hundreds of them, hundreds that occur in rapid succession together. So you've got to have the mobilization, stabilization, you've got to have that coordination. And for our listeners who are interested in research, just to mention, the International Journal of Orofacial Myology is open access. You do not have to be a member of IAOM to access that. Dr. Nancy Pearl Solomon worked very hard. It is open access. You do not have to have a membership or pay dues. You can get that information. International Journal of Orofacial Myology. You can access that. It is open access.
Excellent. And I know that you have a couple of 2 or 3 or 4 articles in there. Yeah, that's excellent. Yeah, perfect. Good.
One is related specifically to preparing students, in this content area. So that's on there. And there are some really good articles out there about working with children with disabilities who have myofunctional issues. I mean, there's practical, relevant articles. There's more research heavy pieces. And they just did, I believe, a special issue, if my memory serves me correctly, because I read a lot too, so I try to keep it all straight. They just did one on breathing, airway, sleep disorders, and that piece. So they had a guest editor in that area. So it's open access. Perfect. Go check it out and learn to your heart's content.
Yes, there's a lot of information in there. Now, one
And
of the things,
stabilization, Dr. Nancy Pearl Solomon is doing, she's done a lot with the bite blocks and stabilizing the jaws.
done a lot
A
with
lot of her
jaws.
research has been in that area too. So if you're
Yes.
interested in that, and how to stabilize that jaw and, get them in good coordination together, there's research there in IJOM as well.
Good. Yeah. Now, I've been following Dr. Solomon's work for years.
Mm-hmm.
She's one of the
Yeah.
people that I
She is a
followed.
heavy hitter in the
Yeah, she
research
is.
world, and she's
Yes, she
former
is.
editor-in-chief of AJSLP.
I know.
I mean,
I
she is
know.
a dynamo when it comes to research.
Oh,
Voice,
she is. She's
anyone needs
amazing.
voice research, apraxia, dysarthria, she's got a lot of good research in those areas too, but she's
Yeah.
really come into the myofunctional side, and she's published many articles with us too.
Yeah. No, I was so excited when that happened a couple of years ago. And I mean, I have such respect for her and for her
Mhm.
work. And I kind of got to know her a little bit. And
Mhm.
she is down to earth, but knows her stuff.
And so
And
smart.
she is
So
so smart.
smart.
Yeah.
Yeah.
Yeah. I
Yeah.
was just excited to work with her and just to kind of pick her brain with a few things and get off on some tangents. But she is focused on information and from a practical standpoint. I mean,
Yes.
which is what you want.
And
Yeah.
good and quality research,
Hmm.
quality research. And I mean doing it right and doing it well.
Yeah.
Yeah, she
Yeah.
she holds herself to a very high standard. So,
I have no doubt.
and
No
she's
doubt.
elevated our journal and our research in this area. So, absolutely.
Yes. Yes,
Go
which
check
is
that
so
out.
good. Yeah, there you go. All right. So one of the topics that we kind of wanted to cover just a bit are oral facial myofunctional disorder trends,
Hmm.
like current trends and what's trending right
Uh-huh.
now. And you did mention a little bit about the sleep disorders and that kind of thing, but
Mhm.
what, like what's current?
Well, the sleep disordered breathing is really taking a foothold in myofunctional disorders. We had our 2019 convention, IOM was Airway is Everything. And we had the protege of the Stanford physician who originated the term, sleep apnea, obstructed sleep, breathing, all those terms. His protege came and talked to us. The name is escaping me now, of course. So, but that's a trend. But even especially within children, those of us who work with the pediatric populations, we're really, and I tell my students, stay tuned with this because this is big. Sleep disordered breathing in children, because I think a lot of our kids who are diagnosed with attentional deficits, really, we need to start looking at the sleep disordered piece, and children who have behavioral issues. We really need to look at the sleep disordered breathing. I wrote myself a post-it note of all the trends I wanted to mention. Breastfeeding, tethered oral tissues, big. I tend to lean on the side of, I don't think every child needs a frenectomy. I tend to be on the more cautious side of that because we've got some research that it doesn't work a lot of times. And we've got some kids populations who are being targeted for frenectomies because we've got providers not within our field out there. It's revenue generating procedures. So I want to caution SLPs. When I talk to school-based SLPs, they're getting a lot of calls from parents because other professionals have suggested, that there be the laser scalpel be used. And, they're asking, well, parents are smart. They're going to ask, well, what's that going to do? Was it going to make a difference? Is it necessary?
Yeah,
So
good
tethered oral
questions.
tissues, breastfeeding. I don't work with breastfeeding moms. I've been a breastfeeding mom, but I don't work with breastfeeding moms. And that side, piercings, yes. We've had some
Like
articles
tongue piercings kind of thing?
Yes, but getting the uvula pierced.
Uvula pierced.
I know, I
I'm
know, I know,
sorry.
I know.
Where have
It,
I
it makes
been?
me cringe. We've had some within the orofacial myofunctional community. We've had some articles of cautionary tales come out about that. yeah, I'm certainly not in the age group where I'm going to do those kinds of
I'm
things.
out of that loop.
But we need to, if people ask us about it, that's a very vascular area that could lead to some really negative,
Yeah. Yeah. In other words, just
undesirable
don't do it.
things to
Do
happen.
not do it. Yeah. Do
Yeah,
not
let's
do
just
it.
not do that.
Yeah. Just forget
But of
that.
course, now in clinic, it's popular among students to get the tongue piercing, and we have to tell them it hasn't been an issue for the past few years, but it has, of course. If you've worked at a university for 20 plus years, you've seen students with tongue piercings, and we have to let them know, look, you're trying to teach placement of speech sounds. And to have good placement, you should not have that obstruction in your own mouth. And so we have to have a discussion about that. And then the last one, this is not a trend so much in our clinical populations. It's a trend among us as SLPs. Lip enhancers.
Oh.
The fillers. Yes.
Oh.
More and more women. And I say, hey, if it makes you feel good about, I have not personally, partaken in that, but if it makes you feel good about yourself, I'm all for what makes them feel better about themselves,
Yeah.
But we do have, this thing called the lip flip going on where they might overdo the enhancers, or maybe they haven't settled in after you get the plumping treatments. And so some speech pathologists are reporting, I'm having some trouble doing therapy because they can't get their lips together to show the proper placement. And I presented on this not long ago. That was one of the trends. Of course, it can lead to some lip incompetence, straw and water bottle use, spillage if your lips don't come together. And then, of course, some of the sounds. But we're calling it the lip flip. And that's, we're always talking about the people with whom we work, but this is something that's going on within our field. So,
okay. So I'm not getting the picture. So if they're trying to plump their lips, make them bigger, what's her name? The lady that has the lips and whatever, has all those kids and what's her name? Movie star.
I don't know Angelina Jolie.
Angelina, yeah. I think she kind of brought that forward. I mean, I don't know. What do I know? But I'm wondering the lip flip. So what does it look like? Do they get too big? Do you end up seeing the underneath part?
The lips are too large and they flip apart. They flip. They can't rest together. They can't come together.
That's awful.
Yeah.
Can it be undone? Do you know?
Well, the filler doesn't last forever, so it's temporary.
Okay.
But, in those first few days, or maybe that first week, could be up to 2 weeks after the enhancers, some clinicians have reported some issues, and some have reported some lumpy lips even. So you could see that could cause some problems.
Yeah.
And there have been some, I won't say these things in polite there have been some funny stories that have come out, and I'll just leave it at that with problems that people have had. So
okay. Yeah. Well, these are some trends that I've never heard of. Yeah. No, I can relate to the tongue tie one and those kinds of things, and also the sleep apnea.
And that's trendy. That goes in and out. I mean, you and I have been in the profession long enough. We've seen it. It's really trendy. And
things come and things go. And I'm just hoping that orofacial myofunctional disorders stay. And within it, we can get all these trends and things. But that's very interesting. Very interesting. Oh my gosh. Yeah. Well, good.
I bet you didn't even think for a second the podcast would go in that direction. Yeah.
I didn't. Plumping of the lips with, what did you call it? Lip flip.
Lip flip. Yeah. If you get too much plumping,
okay, I'll have to Google it.
You can't get that good seal. Yeah.
Okay.
Yeah. This was I don't know if you all can see my presentation that I did. That was my,
Oh.
Yeah. Oh. That was my diagram, my picture, that I used to kind of,
How fun. I love it. Well, Hope, you're a wealth of knowledge, and you're just so much fun to talk with. I think I'm going to have to kind of begin to wrap this up. And I thank you so much for your information. But I want to thank you for being here, taking time out of your busy schedule, and sharing this great information. I really do appreciate it. And in closing, for all of you, I do want to thank you for being here and for tuning in and for continuing to get the word out about the SpeechLink podcast. And in a few days, you'll be able to access this course through speechtherapypd.com and watch it again if you want. And if you so desire, you'll be able to access the audio only version on most popular podcasts like Apple Podcast and so on. So thank you so much for your supportive comments on those podcasts and your good reviews. I greatly appreciate it. And also, if you're planning ahead, first coming up this month, I am personally a guest on Madeline Metcalf's Making Sense of Myo podcast, and my topic is 3 practical points of myofunctional treatment. Secondly, on the SpeechLink podcast, Rachel Arntzen of Talk It Rocket, maybe you know her, and she's going to be speaking on an effective and systematic therapy format for young children and caregivers. So then also, I am personally doing a live 1-hour course on 5 super sound stimulation strategies beyond the basics of traditional techniques. Okay. All right. Thank you. Thank you. Thanks again, Hope, and to all of you. And I hope you know how much you are appreciated. And thank you so much for all that you do for your therapy kids. So we will see you soon. Thank you. Thank you. Bye-bye. I'm thrilled you tuned into the SpeechLink. I hope it was helpful. Just leave a quick review and subscribe to be a part of a select group that receives every episode. For CEUs, go to speechtherapypd.com. And for everything else, visit charboshart.com. There's free materials, articles, books, and my blog, Therapy Matters. Thank you for all you do. See you next time.